want it replaced with
Yep, I saw that one.
shut the drain
Yeah.
off so it makes pressure.
Yeah.
I didn't go down
So
there.
I've been on like
Thank you.
10 eye drops a day. Just, it hasn't worked, so. But I can see, which is more than, they told me it was quite a miracle. Most people that could have the surgery don't come out in 2020.
Okay, I hereby call this meeting to order. Welcome, all of you. Thanks for joining us. I've asked Brenda to lead us in the pledge. If you would, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, all our board members are in attendance today. And there are addendums to the agenda, and they include an HR report and then the PCSD 25 roadmap, community and staff feedback. Okay, I would entertain a motion to approve the agenda with the addenda.
I move that we approve the agenda with the addenda.
I'll second.
Second. All those in favor?
Aye.
Aye. Hearing none opposed, the motion passed. Next is the approval of minutes. Let's see, and there's only 1 minute on there. Isn't that something, just one?
I know, I saw that yesterday.
Regular board meeting, budget hearing on June 16th, 2020. Anyway, I would entertain a motion to approve the minutes as presented.
I move that we approve the minutes as presented.
Okay, all those in favor?
Aye.
Aye. That motion is passed. The next on the agenda is the approval of the consent agenda, which includes authorization of payment of claims, approving the supplemental financial information, and approving the human resource activity. Is there a motion?
I move that we approve the consent agenda as presented.
I'll second.
Okay, all those in favor?
Aye.
Aye.
Aye. That motion is passed. The next on the agenda is public comment for items that are not on the agenda. And having received no comments, written comments, we will move on. Next is reports. Courtney Fisher, you'll be talking to us about the media report and the community relations update first.
Wonderful. Good morning. So it has been a flurry of activity around the district office lately. I wanted to report that the Festival of Trees, the Ed Foundation Board of Directors did meet in June and decided to suspend the Festival of Trees for 2020 as it is normally presented. We are exploring options to do some virtual activities, so we've got our committees working on brainstorming ideas. I will report those to you as those details are finalized, but we talked about some really creative ways to build community. You know, we think that that's still really important around this time of year. The festival serves as a community bridge between the district and the community, and so we will have a focus on lifting spirits, building community, and doing, you know, a much smaller scale with not the focus necessarily on fundraising, but on community building. So I will keep you informed as those plans are made. And then communication is in development, so with our sponsors, with our community, with our staff members, to keep them well informed on that. Any questions on festival? Okay, moving on. We are also, as a district, involved in a community education campaign called Stay Smart, Stay Safe, and Stay Open. And that community education campaign is in partnership with Southeastern Idaho Public Health, Idaho State University, the City of Pocatello, Portneuf Health Partners, Pocatello-Chubbuck Chamber of Commerce, and School District 25. So you may see as you go out and about, if you're moving out and about in the community, billboards with this message and all of our logos, and we're doing social media posts and really working in partnership with these different agencies to show that we're all in this together in our community. Also wanted to report to you that the City of Pocatello had a special work session last Thursday Chairman Mattson, Dr. Hell, and I all attended that meeting. The specifics of that meeting were to discuss the proposed mask ordinance, and the city invited local health experts, medical professionals to share their expertise, inform and educate the council on wearing masks and the importance of that, as well as discussing other mitigation strategies we can work together as a community as we work to prevent the spread of COVID-19. Dr. Hell was invited to share a little bit about the roadmap. Mayor Blatt invited us because he wants everybody to be on the same page as they develop their plans and understand what we're doing within our schools to help do some of these prevention strategies. So to date, they have not mandated the use of masks, and they did not take any action at this work session, so we'll stay tuned to further meetings to see what they decide to do or if they take any action in this regard. So that's it for the media and community relations presentation, and at this time I'd like to invite Ms. Miner, Ms. Pettit, Ms. Craney, and Ms. Wilkes to join me, and we're going to discuss the roadmap. We have a lot to get through, so bear with me, and we'll take questions sort of as at the end after we present sort of the key findings and key strategies that we'll be doing along the roadmap. So in regards to development and planning, district administration has been working to develop our reopening plans really since we the last day of school on May 28th, 2020. In addition to district leadership, Ms. Marianne McGrory, president of the Pocatello Education Association, represented teachers in the development of the plan. And it's important to note that we worked hand in hand with Ms. Maggie Mann, who's the director of the Southeastern Idaho Public Health Department. We've been participating in weekly conference calls with Ms. Mann and even daily communication when we have questions, texts, emails. I have to publicly thank Ms. Mann and her department for their openness and their responsiveness and their availability to our questions. They are always responsive and eager to help us as we work to solve some of these challenges over the coming months. We will review the categories momentarily, but I would like to note that all decision-making has been and will continue to be informed by the guidance from state and local officials. We will follow their direction, but at the same time, we value the local decision-making authority that we have to be informed by that guidance, but also make the decisions that are in the best interest of our school communities and our community at large. The draft plan is flexible, and it allows the district to make adjustments as needed depending on the spread of COVID-19 and the best information that we have at the time we're making those decisions. The roadmap, which you all have seen a copy of that, is intended to be a fluid document, and it is subject to change as more information becomes available. The plan is informed very intimately by SIF's COVID-19 Regional Response Plan. That plan defines the risk levels and the mitigation strategies for each risk level, and we'll go over that just a little bit in more detail in a moment. The decision to transition between 1, 2, and 3, those categories, will be made in conjunction with state and local health officials, also following Governor Little's Rebound Idaho Plan and Southeast Idaho Public Health Regional Response Plan. We are in daily contact with SIF leadership as we work to develop and finalize these plans, and as we continue to move into the first day of school and progress throughout the school year. As of today, Tuesday, July 21st, our community is in Category 1. Although it is important to note that as of today, we rose from 72, which is an important marker that's monitored cases, to 92, which, if you have noted on the draft SIF plan, 88 is the marker for that. But we'll go into some of those other things that we're looking for as SIF makes these decisions to move between categories. It's important for our community to know that we as a school district are not responsible for transitioning between those categories. We will be informed by SIF what category Bannock County currently is, and it's not dependent on the entire region. it can be separated by county and even by city, depending on what those factors are. That document is currently in draft form, and so it's not our document to share. We have seen a draft. It is informing our practices. We will link to that draft so that our staff members and our community members have ready access to it once that plan has been approved by SIF. And we've been told that plan will be up for approval. They're reviewing it now with their board, and they will either vote this week or next week is what I've been told, and we'll try to confirm that tomorrow morning with our call with Ms. Mann. So just a couple of things on the draft regional response plan, what to know about those risk levels. The risk levels may be applied at a town, city, county, geographic, or regional level. Different parts of SIF's region may be at different risk levels. Those risk levels can increase or decrease. Movement from one risk level to a lesser risk level will occur at a 14-day intervals, one incubation period for COVID-19, while advancement to a level of higher risk can occur at any time. In general, the risk levels are cumulative. For example, the minimal risk is the baseline. Always prepare for the next risk level. In addition to those metrics determining exposure risk, that's like the marker, the 92, public health officials will also closely monitor and take into consideration for movement to a different risk level the following: input from our healthcare providers prior to data being available for decision making, trends in positive cases of COVID-19, including positivity rate of testing and turnaround time of test results, supplies of personal protective equipment for healthcare providers and first responders, effectiveness of contact tracing, COVID-related hospitalizations and deaths, and healthcare provider emergency departments, urgent care centers, a sampling of primary care provider visits with COVID-like symptoms. So as you can see, it's not going to be dependent just on a number of those. When you look at SIF's website, the category that we want to be looking at is the monitored cases. That will be defined in here for what number of monitored cases they're looking at, but also in conjunction with these other components. That's really important to note. And those numbers have to be 3 days in a row in addition in correlation with these other risk factors. So that's, I think, what's most important to understand about SIF's regional response plan at the moment. So we've designed a few communications to go along with this, and the first is the at-a-glance roadmap, which is included in your addendum today. This was designed to be just at your fingertips, the most important, what we thought parents, I'm a parent of 2 daughters that attend School District 25, so I often think, what would my questions be? What do I want to know up front? So we have offered that information here at this at-a-glance so that we know these are the guiding principles that have informed our decision-making. Our starting date, we will start school on Monday, August 24th, regardless of which category we're in and which instructional model that we're in. We are still rolling forward with our one-to-one Chromebook initiative, and we have already added access points to each one of our schools so that in the event that we have to transition to a hybrid setting or a remote setting, that our learners will have enhanced access to the internet to serve their learning needs moving forward. Also on this document is talking about the spread of COVID in K-12 schools, and this is where we talk about the categories. We wanted to be consistent and in line with what other authorities, the language that they're using, and so it's easy for people to understand what the state of Idaho is talking about, our local health district. So we have defined category 1, category 2, and category 3. Category 1 is low to no spread, and that is currently what our community is in as of today. That will be a regular school schedule with focus on prevention and education. Category 2 is the minimal moderate spread, and school schedule may include a modified traditional schedule and or a hybrid schedule. And we'll go into that a little bit more later. Category 3 is substantial spread. This is high risk category, and remote learning may include targeted, short-term, or even extended school closures. We've defined our overall prevention strategies. our daily attendance. We will still be recording attendance, but that attendance will really be informed by COVID-19 practices from the State Board of Education, the State Department of Education. So we will continue to define that as more decisions are finalized. And then coursework and grading, this is not going to be like the spring. It's going to be a robust, comprehensive, rigorous educational experience for our learners, whether they are attending school in person or online. Standard grading practices will apply, and options to complete coursework through alternate methods will be available. That includes our online learning program, and we are communicating to parents right now about the deadlines for enrolling in that online learning program, should they want that. And then we have activities and athletics guidelines, which Ms. Brooks will go over a little bit later. And then symptoms. What if a staff member, or what if a community member, a learner, experiences COVID symptoms? This is taken directly from the health department. This will be our mantra as we move forward over the next few months and through the 2021 school year. What do I do if I'm sick? And then if I do have symptoms, when can I return? There are 3 really important markers for that. So people need to be self-monitoring and following these categories to discontinue self-isolation. At least 3 days or 72 hours have passed since recovery, defined as resolution of fever without the use of fever-reducing medications, improvement in respiratory symptoms, for example, cough, shortness of breath, and these are all 3 things, and each one has to be met. At least 10 days have passed since symptoms first appeared. So we've been working really closely with the health department to make sure, because we've seen some variance in what the health department says and then what local medical providers are saying. And so SIF is reaching out to local health professionals, medical providers, to make sure that we're all using the consistent language. This is what you do if you are going to return, to be able to return safely. That's the at a glance. Any questions about that so far? Okay. So the roadmap, we'll just go over again. From the at a glance, we decided to lead with our guiding principles. Really note that these guiding principles and everything contained in this roadmap is subject to change based on new information or direction from the state. And then on page 2, we have our decision-making flow chart. This is informed by those categories that we briefly touched on. Category 1, that low to no spread. Category 2, the minimal to moderate spread. And category 3, the substantial spread. The instructional model will be determined by the school district, of course informed by the direction that we're given by state and local health officials. And then our response, whether we're open or closed, or doing a hybrid model or remote learning, those decisions will be made in conjunction with health officials. So this gives you an idea on, in the category green, we have low to no spread. We'll be opening traditionally with prevention and education and those personal protection equipment strategies in place, physical distancing strategies in place. And then if we're in category 2, which is minimal moderate spread, will be either modified traditional, if as much as we can, keep that traditional schedule, or we'll be in a hybrid approach. And we've got some definitions of what that hybrid approach might be. And then if we're in substantial spread, we'll be in a remote learning setting. That may be district-wide, or it may be school to school, depending on what's happening in that school. It may be minimal use of school buildings, targeted remote learning, or adopt district-wide learning as we did in this, district-wide remote learning as we did in the spring. Targeted closure, where we close down a classroom, close down a school, really clean, really disinfect, open back up, or short-term closure, or an extended closure as we did in the spring. Page 3 just gives some definitions. about those categories again. It's really important. We really need to educate our community on what these categories mean. And then we've got definitions on face coverings, hand sanitizer, cleaning and disinfecting, physical distancing. Page 4, we start talking about practicing and prevention. And on this document is on sd25.us, and these links are all live. And so we wanted to make sure that we included the resources that really inform the development of this plan. And so people can go in and click and really dig in deep. We wanted to give people the option to look at this at a glance, read what they wanted to read, or really dig in to the information and understand as much as they want to. So those resources are all included on the left-hand side. So we've got our standard operating procedures and preventative measures, reinforcing good hygiene, hand sanitizer. We've increased the number of hand sanitizer stations that are available at our schools. We will be posting signage at entrances to schools and gym entrances, hallways, markers for social distancing, physical distancing on the floor. Cleaning and disinfecting high-touch surfaces is going to be really important, and we've been working really closely with Mr. Bart Reed and the maintenance to identify how we do that in a way that doesn't take away from instructional minutes, that can be done really safely and effectively, but still so we can focus on the heart of learning. Recommending that requiring staff to wear masks, and also we'll get into some further recommendations as we go along. Practicing physical distancing, conducting deep cleanings of schools, monitoring the ventilation systems. We've learned through this process that our ventilation systems, we have updated HVAC systems in each one of our school facilities, and those ventilation systems replace the air 6 to 8 times every hour and are digitally monitored. So we know that we have, it's not health grade, but it's really a high standard of ventilation in our schools. And then we, of course, will utilize social media to and other communication tools at our disposal to be in constant communication with our staff members, to keep them informed, as well as our learners and their parents and our community at large. As we go over to minimal moderate, we've got some, we'll continue category 1, standard operating procedures, but we have a few more that are identified in category 2. And then, of course, category 3, those school buildings are closed. Page number 5, transporting learners. We've got a plan for our transportation and our busing. So that is identified there. And then entering school and exiting school buildings. We've got strategies for there. And again, it's really important to note that anything included in the low-no spread will also continue in category 2.
Can I interrupt you for a minute?
Yes?
On the transportation, I'm wondering how you're social distancing on the buses.
Yes.
So that was one of my first concerns, especially with athletics. How are we going to do this? We don't have enough buses to double the number of buses for every soccer team, for every, you know what I mean? They're just not enough if we wanted to do that. So I talked to Maggie Mann yesterday, and I said, give me some guidance. Do we need to go to parent transportation? She said, no. Right now, what we would be okay to do is just require face masks among the students, and then as soon as they get on, they wash their hands, and we crack the window for airflow. She said that would be sufficient, and then it maximized social distance as much as possible, but that would be efficient for now, and unless we get to that category 3 stage.
So are we at a point where we have just 2 students per seat? Or would you?
She did not give us a number. Right now, we typically have about, he's not here to answer that.
I mean, I'm just, you know, I'm thinking of 3 kids cramped on a seat versus 2,
Right,
you know?
right.
So that's a concern to me. I mean, I can see how the other would maybe work, but I'm still wondering transportation-wise how overloaded our buses could be.
We'll ask Mr. Reed to jump in here since this is his area of expertise.
So in some cases, if we have a bus that has a capacity of, say, 60, and we have 30 students on a bus, we can put them on every seat, one student to a seat. But if we have situations where we have 50 students that are on a 60-passenger bus, there's really no other way other than to have two students to a seat.
Right. But we don't have any where 3 students would be on the bus. on the
Well,
seat.
at this point in time, we really don't know. And we are halfway anticipating or expecting that we have approximately 4,000 to 4,200 riders every day under a normal school year. We're anticipating that probably parents are gonna transport a lot more than having their students ride on a bus. So if our ridership goes down to 2,000 students versus the 4,000 we're accustomed to, then that's gonna make it easier for us to do the social distancing and keep the separation. But we just don't really know until we get into the first day of school to where we see where we're at.
But what I'm saying is, can we have a guideline that no more than 2 per seat?
Do we have bus routes that they're sitting
A bus route, I mean, that could be a guideline that they can't have more
We,
than.
we could make a guideline as you're suggesting, but we need to remember that we only have 85 buses and we have over 1,200 stops, and that's in the information that you have with you today. And we run, we run our elementary students first, and then our middle school, and then our high school, or middle school, and then our high school. And so all those same buses are used to transport all those same children. So we can't, we don't have enough busing or buses to do like a double schedule of pickup and drop-offs and things of that nature.
So your hope is then that this will kind of take care of itself by parents self-transporting?
Well, we think that that some of it will partially be taken care of by parents self-transporting. We anticipate that we are going to see that. But how much we can actually expect, I mean, what will actually occur versus what we maybe think that may happen is still unknown. And we won't really know until we get into those first few weeks of school.
Here's another question, a
Pardon?
little farther down the road, but we normally have some bus counts that determine how we're reimbursed. And what if the numbers go down? Will we get less, or is the state looking at the fact that because of the COVID virus, we're bound to be facing that?
Well, there's two formulas, two ways in which school districts across the state can be reimbursed. One is on ridership, basically cost per student, and the other way is on a cost per mile. And you can take whichever one of those is the most cost effective.
Okay.
So I don't think that we're going to be impacted by COVID by not being able to be reimbursed for transportation.
Okay.
But this is going to impact school districts across the state and across the nation,
Yeah.
obviously.
Okay.
Can we require that they wear masks on the buses, or just encourage them?
I think that we have said that we strongly encourage students to wear masks. We have not required them. Is that right, Dr. Howell?
For now, I think in the proposal, given the escalation of cases and what the feedback that we've received, the administration may be making a recommendation to change that. And certainly, the board would have some discussion on what you've read and seen and heard and your thoughts. Yeah, so I think that one's probably up in the air, but you're right, Mr. Reed. As written, it was strongly encouraged at the time.
Right.
And
But
so
that could be modified or changed.
With the athletes, if they were wearing that, saying you could put 2 seats down the top.
I mean, you said that's what the health department recommends. So, I mean, to me, if you require it or you highly recommend it, those are 2 really separate things. And one, it will happen, and one, it won't. You know, so that's my feeling.
So with the feedback, we'll likely have some proposals for you to consider to amend this draft agenda, and then the board can have some discussion as to what you would like to see in the final.
Good.
Okay?
Thank you.
Thank you.
Thank you, Mr. Reed. Still on page 5, entering and exiting buildings, there's some important things in here. We've gotten some further guidance from the health department on this, but we're asking parents, just as an extra measure of precaution, take temperatures at home. I have some documentation from the health department that's saying it's not feasible to take temperatures as kids are walking in, nor is it a reliable marker, because learners can be asymptomatic, and it's a resource issue. So we've got a statement that we'll include in the FAQ about those screening mechanisms. But we are encouraging, if learners or staff have a fever at 100.4, to please stay home and take that recommendation very seriously. We'll be implementing our standing operating procedures for entering and exiting the buildings, encouraging physical distancing, limiting of congregation, following protocol for those who feel ill, which I went over with you earlier. Limit visits. This is going to be very important to emergency and or essential volunteers. That will be determined at the school level, what those are. Following protocol for visitors, those include calling ahead, require all visitors to wear a face covering or mask upon entering the building, and then prohibit any non-essential deliveries. That's really important. And then in the minimal to moderate spread, marking space lines to encourage physical distancing. I think we're doing that even in no matter what, so that needs to be moved over. Screening symptomatic learners. If somebody becomes ill, we have thermometers at every school, as well as special education or special population programs will have a thermometer. All of our athletic programs have those touchless thermometers. And again, maintaining confidentiality and strict adherence, as we always do, but even just taking one measure deeper into that confidentiality and adherence to FERPA and HIPAA, and then following protocol for learner pickup and drop off. So we'll be doing some communication about that may encourage parents to self-transport, and some of these categories will kind of intertwine that way. If school buildings are closed, we will limit that building access to essential staff to carry out critical functions, and utilize virtual tools and platforms to, whenever possible, to keep that in-person reporting to an absolute minimum during those school closures. Serving school meals, implementing again our standard operating procedures, and we have a link to that so that people can go back and forth and see what those are at all times, no matter what section they're in. Really focusing on communication about washing our hands, using hand sanitizer before we enter the cafeteria, ensuring that cafeteria workers distribute the food items, using disposable trays and utensils, and emphasizing food and drinks and utensils not to be shared. We will have designated flow paths, and then we will consider alternate methods of serving and where our learners are eating lunch. If it's nice, they can do a rotation where they eat outside, they eat in the classroom. We've heard some really creative ideas where building administrators are solving some of these challenges as it best fits their school. And so we'll develop those and share those details as they're shared with us.
I did notice that a lot of teacher input did not want it in their classrooms. That's one thing I noted. I saw that in your minimal to moderate spread about classroom, serving in the classroom. And I did notice on the input there, most of them were not in favor of that.
And if I may, I don't know if I'll touch on it correctly, but I wonder if they're concerned about the duty-free lunch. And so if that were the case, if it's not just a space issue or a cleanliness issue, but if it infringes on that, then we'll be able to work out that detail with some paraprofessionals.
And then, of course, if school bins are closed, we will continue to serve lunches as we have been since March. We've been serving breakfast and lunch for several months. I'm not sure what number we're up to yet. One thing that we will add, I was going to add this in our proposals and changes moving forward, but I can hear Ms. Pettit. So we have explored the opportunity to create cards that can be scanned with the student's lunch number, so that we don't, normally they touch the pad. And so we were really worried about, having hand sanitizer between every use would really slow down the process. And so working with technology, we have created a solution where we will print barcodes that can be scanned very readily and easily, either attached to a middle school or secondary learner's ID card, student ID card, or we've got some solutions for elementary where they just have a packet of cards that they scan or a sheet. So that's good news and something that we'll be adding to the roadmap moving forward. Anything else? Okay. Transitioning, this is going to be a big challenge, and it's going to have to be solved at the school level, but really trying to maintain that physical distancing between those transitioning times. Marking those spaces, limiting mixing of groups, kind of staying in student cohorts whenever possible. Staggering releases are some mitigation strategies that we've included in the minimal moderate spread, and then we won't have to worry about transitioning in category 3. Conducting large group gatherings. This really applies to our athletics, and I know Tanya will go over this in more detail, but we'll follow IHSAA guidelines for athletic events and practices, prohibit large assemblies. Requests for assemblies will be granted on a case-by-case basis, but we really, as a matter of principle, won't be holding mass large assemblies. Abide by maximum group limitations as defined by Idaho's rebound plan. And right now, where are we at? Do you know?
The numbers?
Mm-hmm.
So right now, there's not a number for Southeast Idaho for max number, but definitely per facility, keeping that social distancing. So depending on the facility, we'll have a facility guidelines for spectators.
And where will they be posted?
What the guidelines will be?
Yeah.
It depends on the category we're in, but we actually ordered signage 6 feet apart that we'll put on the bleachers. And then depending on the gym space availability, it might be immediate family only and things like that. So get it by school, by building and so forth. So that will be prepared in the first weeks of August, depending on the facility itself. So the ADs and I will put that together. Fortunately, most of our sports in the fall are outdoors. So, Holt Arena will have their own recommendations as well that we'll abide to. But it's a huge facility, so we're hoping that we can accommodate as much as possible. And then volleyball, each school has 2 gyms, so we could utilize that as well. So doing one team at a time and then having time between the teams. So we're trying really hard to not limit too many fans, spectators, but we will have some limitation.
In category 2, our building administrators are masterful at coming up with creative solutions. So, should we have the need to space out, or we'll do that on a case-by-case basis as we hit category 2, weather permitting, and using the spaces that are at our disposal to create the greatest physical distancing possible. And then, of course, category 3, our school buildings will be closed and large gatherings will not be permitted.
And then that is the recommendation from IHSAA as well. If we're in category 3, all sports will be suspended at that time.
Supporting teaching and learning. So again, we will be implementing standard grading practices, reporting daily attendance in accordance with COVID guidelines, implementing our one-to-one Chromebook Learner initiative, increasing wireless access points, providing access to credit recovery programs where necessary, integrate blended learning opportunities into the regular curriculum, implementing seating charts in classrooms, providing professional development for staff to increase digital fluency, increase space for physical distancing by removing non-essential furniture, and limit locker use. And then under minimal category 2, this is where we would move to a modified traditional instructional model or a hybrid instructional model. That modified traditional could mean that we limit or prohibit partner group work, increase the distance between workspaces, keep elementary cohorts together as much as possible, utilize large spaces such as outdoor gymnasiums, auditoriums when possible to encourage physical distancing. And then that hybrid model, we've created an FAQ and we've really kind of gone into what that schedule might look like. So we may do alternating days where we have a group A that would come Monday, Tuesday. Everybody goes remote on Wednesday, and then we have group B that's in person Thursday, Friday, but they're remote Monday, Tuesday. And so that's defined in the FAQs that we'll go over later.
Can I interject one thing there?
Sure.
I mean, I looked at this hybrid model and I remember well teaching, and if I had music on Monday and Friday or something, or I miss music a lot because of special holidays. You know, like, you know,
Mondays.
I mean,
Right.
you know, Mondays or, you know, or something, and so whatever you decide, please make sure you take that into account, because lots of times nobody would want it on a certain day, because half the time the kids, it would be a national holiday or something and the kids wouldn't be there.
Mhm.
So you'd really miss out. So just take that into account when you divvy up those days, however you do it. The number of holidays that fall on, it's usually Monday or Friday. You know.
Okay,
Okay, thank you.
that's great feedback. Thank you.
A week, so they teach 2 days in person, and then these 2 days in person. These lessons can be the same. The online lessons can be the same, but they have a whole day to work on getting that online curriculum. So what the thoughts are is that we can get kids ready on those 2 days to do the foundation, and then do the extension stuff on the online. So yes, but
And then that,
Provided a day for them.
we provided a day.
yes.
And we'll provide some professional development. I know right now our tech coaches, our instructional tech coaches at the district level are looking into what does that, blended model look like? So that we'll have suggestions on what it could look like, what types of things could be done, remotely. So you might, for instance, students might be reading the text at home and then coming to class and be ready to discuss and all, so that it could flow, easily. So we know that we don't want to burden teachers with both of those models. That could be really hard, so we want to be sure that we provide them lots of guidance and lots of examples and all along the way.
And in the example that's provided in the FAQs, you have Monday, Tuesday teaching day in person, Thursday, Friday teaching day in person. Wednesday is that day to clean and that preparation day for teachers. That's built into there.
But kids are doing 2 days in person, 3 days online.
Reiterate that. So 2 days, I mean, I thought you said 2 days with the teacher, then a day off, and then 2 days with the teacher again.
A and B.
The teacher has that day to clean and do a planning preparation day. The students are still Wednesday, they're doing that remote online learning
On Wednesday.
on
Yes.
Wednesday. Mhm.
So, but they are in the classroom on
2 days a week.
2
in each
days.
classroom, 3 days remote.
3 days remote.
Mhm.
So if I was a kid, my schedule would look like Monday and Tuesday, face-to-face, Wednesday, Thursday, Friday, online activities and reading and work and so forth.
Or if I
Come
was in,
back.
right.
Because I saw some that were A, and like they go one day, then they stay home, and then they go the next day, and
And
then
we
they
can do
stay
that
home.
It made more
Yeah.
sense to keep the kids in the classroom, like Sue was saying, to minimize the cleaning, the same group of kids, 2 days in a row, then clean on Wednesday, prep, and then the different group of kids, Thursday,
Different group
Friday.
on.
And they had
that's right.
online Monday,
Okay.
Tuesday, Wednesday.
And so I think
Yeah.
we're still
But we're
discussing
still-
those
Yeah, those are
different models
options.
in there, but basically, I think all of our discussions center around the fact that there would be 2 days that they would be
In person.
That's-
in person,
Yeah,
and then the rest of the week.
so
they
it's
would be
just,
online.
so they're split.
Yeah.
Correct.
Right,
so
so
they
you
can
have to
social
have the
distance.
kids.
So you don't have.
Yeah, I
That
knew
would
that,
be
I
the
just,
intent.
The teacher will still be in class 4 days out of that week, and then still trying to do online for free, and basically for 5 days.
Correct, and whatever you taught on Monday, you're gonna teach Thursday.
Right.
So not-
If we went with the cohort model of the AA planning BB. Yeah, I think Mrs. Craney, she is in favor perhaps of the other model of an AB, cleaning, planning, AB. So we're still in discussion about what that will,
About what the hybrid.
yeah, and perhaps Ms. McGrory could give us some feedback as to what she's hearing from the teachers.
Teachers had a lot of input on.
Yeah, yeah, so we'll take that into consideration as well, because to Mr. Facer's point, I mean, we want to make sure that we're mindful of what they're doing, and essentially that third day, that Wednesday is planning, but it's also having planned ahead far enough that it's another remote day for students, it's not a day off.
Right.
But then the teacher wouldn't have any office hours, or be required to be online with their students on that Wednesday, if,
Just like, just split sessions, basically.
Mhm, yeah.
Depending on what they want.
You've been saying something else, though, and I'm a little concerned about it, and that is the teachers are not gonna have to do the cleaning, right?
No, it's just a day for.
It's a day for cleaning, I understand that, but I just wanna make sure that's not another job teachers have to do.
So would it be possible, I mean, if you teach in a class online, you could actually have one teacher teaching a lot of kids, right? So if you had one teacher that was actually doing the online teaching, did she teach all of the kids at one time, while the other teachers were worried about taking care of them in class?
Well, you have specific online teachers that are gonna just do
Yes.
online teaching.
And then the elementary schools,
In the
in the
elementary,
elementary schools.
specific ones would, all they would do is teach online.
I think one of the things is that this will be more of a blended learning model, so that we're not going to be expecting teachers, so let's say that they have a group one day and one group is at home, whatever model we use. The group at home, it's more of an independent type thing, things that they can do. There might be for a history class, a video clip that they would watch and come prepared. They might respond to, but it wouldn't require the teacher. The teacher would be face-to-face over here, so it would not require the teacher to try to be doing face-to-face. Let me jump over here really quickly and do this remote piece that I have the learners doing. I think that's not what we're seeing, what we anticipate for that. Teaching face-to-face and then giving, assignments that the student can do to come prepared for class that they would do more independently. Does that make a little more?
Well, it does. I just know that's gonna be a real challenge, I think. I think even especially in high school, you think that not a math class, I don't know how the math teachers are gonna be able to teach online without having to be face-to-face with kids online. I don't know, that's all.
I look at it as kind of a flipped classroom, so they could, go over the strategies but then you practice and do those kind of extended things at home online. Does that make sense? So they're getting that face-to-face curriculum, direct teaching, but then they're not doing the work in class, they're doing the work at home.
And that's one of the arguments to do AB instead of AABB, because if you're doing A and then the next day they're following up on it, and then you can come back and follow up on it, instead of 5 days away.
Well, I think the
So-
AA would work pretty good in elementary school. I don't know, I just, I have a daughter that teaches elementary, and I have a son that teaches high school math, and I've been talking to them, and they're really concerned about doing that at all. Either way, and I guess you have to do a lot of creative thinking.
Absolutely.
Well, I mean, my hope is that this doesn't have to go on forever, but if we're finding it isn't working, can we come back and reassess?
Absolutely.
Yeah, I think we go back to that statement of fluid, and something we use frequently in cabinet is nimble and flexible, the need to, there are many challenges ahead that we're gonna have to solve and be able to turn as needed.
If we had a choice, we wouldn't choose this. It's
No.
just-
And then moving to category 3, school buildings closed, we'll be implementing a robust learning plan. Those Chromebooks will be in hand, as well as packets, materials, and mills, and then communicating any drop-off, pickup locations, times, and that for,
I just have a question, and maybe you answered this last, I don't know, but did Chromebooks come back pretty well?
Most did.
Yes.
All but 200?
well, those 200 were mostly still checked out for summer school.
No, I understand that
Right.
number, but the other number I saw was there were probably 200 that
There was
didn't return.
200 more above and beyond summer school,
Uh-huh.
and we have not sent the letters to those parents yet to say, where are these Chromebooks?
You know who they are?
I'm sorry? Yeah,
You
we know
know
who they
that-
are.
okay.
And so we're waiting for the summer school last bunch to come in, and then we're sending out a letter to everybody saying, where are the Chromebooks? Here's how much it's gonna cost you if you decide to keep it.
I'm sorry, I just.
Nope, good question.
Okay. Moving on to page 8, protecting vulnerable populations. We've got a definition of what those vulnerable populations include. Continuing to implement our standard operating procedures, maintaining the point of contact with local health department, helping our community identify if they need to go get tested, where can they go get tested, what are those testing sites, providing hand sanitizer for learners and staff, limiting group interactions for vulnerable learners and staff, also allowing vulnerable learners to complete coursework using alternate methods, as is a choice for all learners. Under category 2, providing alternate learning opportunities, again, in consultation with parents and local health officials, continuing our district-wide commitment to FERPA and HIPAA, and emphasizing strict adherence to state and federal employee law and extended leave allowances. And we go into more detail in that in the FAQs. Substantial spread will continue to provide nursing and healthcare services and/or mental health services when feasible and appropriate. The next section defines our online learning options. So for the elementary online program, the registration to choose this option is August 4th. We will be sending out communications in addition to the roadmap, alerting parents that this option is available and when the deadline and the link to apply. We've got a contact information for the elementary education executive secretary. Our learners are required to stay in the program through the end of the trimester. That's a change. Correct? Okay. So that will be made, in our recommended changes. Our daily online attendance is recorded. Standard grading is applied. Online program is teacher-driven, utilizing our district curriculum, and parental involvement is a key factor to success. We are anticipating, or parents should anticipate, that they would be required to have 4 hours, a minimum of 4 hours daily of work. The secondary online program, that registration deadline is going to be extended to August 14th. Again, we have the secondary executive assistant number there for contacting directly to answer any questions. I know that Ms. Pettit and Ms. Craney have also been having multiple conversations with community members about this option and providing those details and information to them. Those learners are also required to stay in the online program for the entire trimester. Daily online attendance is recorded, standing grading must apply. In the secondary level, those classes must be passed by 70% or better. The online program will utilize our APEX learning program for instruction and curriculum. That requires that one class is taken at a time. It's core curriculum, and it's very limited electives. Every learner is encouraged to pass at least 4 to 5 classes per trimester to stay on track for graduation. And each course generally takes 2 to 3 weeks to complete. And parental involvement, again, is a key factor to that success, and learners should expect a minimum of 4 hours daily working online. And then finally, the last page is just going over, again, when a staff member, learner, or visitor exhibits symptoms at school and those protocols for defining that, as well as a link to the Families First Coronavirus Response Act on that side. And then the final thing is the guiding documents. We've got links, again, where community members, staff members can really dive in deep to what informed our practices as we developed the roadmap. Any questions
Well, the biggest,
before we move forward?
this was a big concern I saw with a lot of the teachers, is just how sick days and all of that were going to be accumulated or used, or when they're required to take 2 weeks, have to be home 2 weeks. And
Mhm.
so I think there's a lot that has to be worked out.
Yes, and we'll be able to touch on those in the FAQs that Courtney has prepared for you in this batch of documents.
Yes.
Mhm.
Okay, so moving on, we're going to talk about feedback. So we submitted the roadmap last Monday with a link to provide a feedback form for community members and a feedback member for staff. We received 200 staff responses and 943 community responses. The feedback collection process was not an anonymous exercise. The feedback form was created using Google Forms, and we are a Google district, so we require sign-in to provide feedback for staff members. This was done by design to ensure that the staff feedback that we received was actually School District 25 staff. Otherwise, anyone with the link would have been able to submit that feedback using that form. The development of this plan has been open, honest, transparent, and very challenging. Requiring staff sign-in bolsters that sense of transparency. We are all in this together, working to find the best solutions moving forward. You'll note in the summary of responses that there are no names attached to any feedback, and we will post a summary of that staff and community responses at sd25.us so other people can see what everybody said, what was the consensus. So in development, in conjunction with gathering that feedback, we identified several frequently asked questions. We decided to move forward with the staff FAQs first, because there's some we understand people are nervous, they're uncertain, they have a lot of anxiety about the unknowns. And so we've tried really heartily to answer those unknowns to the best of our ability. So working from that staff and community feedback, as well as questions provided to the district administration from Ms. Marianne McGrory and the PEA membership, we've been working to identify and develop responses to a comprehensive list of frequently asked questions, or FAQs. And those FAQs were included in your addendum. I don't know how in-depth you want to go over
Now, mine
these.
says community feedback.
The next one down.
No,
Is there,
Click on
so
it.
in your addendum, you have 2 other documents, and we'll just let you go over this.
Yeah, click on it and go before the-
There
Oh,
is,
there it is.
there's a document that says community feedback and then
okay,
staff
I
feedback.
found it.
We worked to identify themes. Ms. Jensen helped with the community one, and I did the staff one. So we identified themes that were prevalent throughout, and we noted how many for that question or against that question. And then there were just general concerns, questions, and comments, and those are also noted in that feedback.
I think we should touch on each one of these categories a
Okay,
little bit.
perfect.
Yeah.
Okay, so again, this also is a fluid document. We will be updating as information is finalized, as more guidance is provided, more information becomes available. The opening of schools is an evolving, much discussed issue in Idaho and the United States in general, and more guidance and even law may emerge as not only the summer of 2020 progresses, but as we move into the school year. So the information provided herein is what has been available as of July 20th. Some of these topics will likely need to be explored as the school year approaches and even as the year progresses and COVID-19 develops. So how do we plan to start the school year? It's really important to us, if we can, to provide that in-person instruction to the best of our ability. That is our ultimate guiding goal. But the instructional model to use to begin the year will be dependent on the category assigned to Bannock County at that time. So as defined by state and local health departments, and we've included information below. We've been working on the roadmap, as I said, since May 28th. Our goal is to keep staff and learners safe in school and moving forward in their learning. And it's also important as we work together to solve these challenges to understand that we are defined by the state of Idaho, the State Department of Education, and the State Board of Education as essential business. Education is an essential business, so we all need to keep that in mind. Again, we understand the heightened level of general anxiety returning to school and returning to work, and reasonable accommodations will be made to reduce the risk of exposure. But just as you've seen in the community, we can't eliminate all risk, but we will work to reduce that risk to the best of our ability. This is a fluid document intended to be flexible and subject to change as more information becomes available. How will the transition between categories be determined? This is the burning question. You'll note on the survey summaries that that's what people want to know. They want to know what category we're in now and what category will we be when school starts. And just honestly, we just don't know. Right now we're in category 1. We're moving up toward category 2, but we haven't gotten there yet. And so we just all need to be a little bit just understanding that there are just certain things that as a school district we just don't have the answer to. So even though people want to know that question, that will be determined by state and local health officials, and we will be guided by that information. So I went over earlier with you the what to know about the regional response plan from SIF, so I won't repeat that. But we provided that information to our staff members so that we could educate them a little bit more about the process. That information will also be provided to the community. And then we will link to that document once it is approved and finalized. It is not our document to share. We have been given a draft for informing our practices, but it is a draft. It has not been finalized. And so it's not ours to share, but once it is approved, we will make that readily available. Will face coverings be required for staff members and learners? This is a change in our initial draft of the roadmap. We require staff members to wear masks. We strongly encouraged learners to wear masks. Based on the feedback that we received, not only from staff members, but also community members, it is our recommendation for you today to consider requiring learners to also wear masks so that we are all covered. We've provided some information here from the CDC about face coverings, and we will continue to be informed by medical professionals and health professionals. Moving on, what is the CARES Act and what does it cover? We've provided the definition of the CARES Act and just a really brief definition of what some of that money can be used for as we face these challenges moving ahead, and providing that personal protection equipment and using those funds to be able to do that so it doesn't come out of pocket for any staff member or administrator. What do I need to know about the Families First Coronavirus Response Act? This is a big one because this is available at a federal level until December 31st, 2020. So we've provided definition about what that covers, how our staff can access it, should they need to. And then again, we don't know if that will be extended beyond December 31st. Will staff members be required to use their own sick leave? If a staff member becomes ill and is confirmed with a positive test result for COVID, they are again eligible for that Families First Coronavirus Response Act, the FFCRA. Again, those provisions are effective through December 31st, 2020. Will staff members be required to use their own sick leave if they are required to self-quarantine? This is a really challenging question. If a school or class is required to quarantine due to a confirmed case or cases of COVID-19, alternate methods, which may include remote learning, will be implemented on a case-by-case basis to help alleviate the required use of personal sick days for staff members. So if a class is ordered to self-quarantine, we will try to keep that learning moving forward so that we're still working, we're still learning, and no use of sick leave would be required in those instances. Personal protective equipment, that PPE, will be provided to all staff and classrooms. This is also in response to, some of the concerns that people have and the fears they have about returning to school. So we will be providing face shields. Staff may choose to use their own face coverings, but we will be providing a face shield to every staff member. Spray bottle with no wipe disinfectant solution. So staff won't be responsible for the deep cleaning, but spraying between classes, using high-touch areas, that will definitely be something that we will ask our staff to do. We will be providing gloves, safety glasses, hand sanitizer in classroom, and also, as I said before, that we have extended the number of hand sanitizer stations throughout every one of our schools. We've ordered signage. We'll be doing floor and wall markings, communication and community education about those preventative measures. And then one of the questions that came up frequently was about that ventilation. So we've answered that here too, where our ventilation recirculates 6 to 8 times per hour in each building room. Roles and responsibilities. Staff members are
Ms.
expected.
Fisher,
Yes.
if I may interrupt just for a minute. The sanitizing, Mr. Reed and maintenance did a nice job of coming up with a solution that is just a tablet or that drops into a bottle. So we don't have all these refilling stations all over the school, the custodians, the teachers trying to keep up with that. And it's just a spray that on the high-touch areas that can be left. It doesn't even have to necessarily be wiped. And so we're appreciative of that effort. And then also regarding the mask, there's another one, Mrs. Minor, that you have there that will implement. Mrs. Craney has visited with her principals yesterday, and as well as Mr. Minor with his ancillary staff that has that transparent. So again, they can see, pronounce. Go ahead, Lori, did you?
We ordered that for our kindergarten, first and second grade, and the people who work with them, because that's really important. I also included in there our behavior techs, because when we're dealing with students who are having some difficulties, being able to see facial expressions is important. So we've included that as a mask too. The shield will also do that, but we wanted to provide another
Additional.
option.
And then Mrs. Pettit will have some available for secondary as well.
And these are for teachers
Mhm.
Right.
and
So
staff.
the shield and then that clear mask. For the clear mask is for the teachers in those lower grades.
Yeah, there was
Okay,
some
so-
question
And
about
if
that.
you, for a few for the high.
So for mandating masks for kids, are we going to supply masks? That's my next question.
Sure.
I know that's what they'll ask.
Right, and we
For those that maybe don't have theirs.
we have a number of disposable masks, maybe not quite the number that we think we may need if the board does ask us to require that of students. And then in some communication with one of the local physicians, he suggested that in a partnership with business, with local physicians, and perhaps Portneuf Medical, that we could buy cloth coverings with even logos of schools for our students. I know Ms. Wilkes has purchased some for coaches and officials in regard to the activities, but that was one that came up just this morning. I received
Yeah.
that email.
I saw that and I thought they'd have to have their name on it somewhere.
For kids.
Elementary kids, they
Yeah.
would have to somehow be able to.
Right, so that is a possibility that we can
Yeah.
explore further into the next week or so.
I'm gonna go back to the ventilation piece,
Mhm.
because you say it's adequate. But do people will ask a question about, how will I know that it's adequate? So what's required?
Mr. Reed, you're
I'll
on.
let Mr. Reed answer that question.
The ventilation and being adequate.
And
Yeah.
I could not hear what you were saying, so I'm
Okay,
Oh.
she was, the statement is that ventilation is adequate, but people will ask, how do we know that? What's required to be adequate for ventilation?
Well, we're certainly not hospital-grade ventilation,
No.
obviously. But we do exchange air. We're required to do that as part of being a public school. When you have 1,000 to 1,600 kids in a school, you have to change the air out several times. All of our system has filters in there. We PM, meaning we do preventative maintenance on those filters 2 or 3 times a year, changing those filters out and things of that nature. So we monitor the CO2 levels and things like that in our schools. I don't know how to answer the question really any better than
I
that,
just
but-
think that when people ask that question, you
Well,
need to have something to tell them about how that works.
It says here, it recirculates the air 6 to 8 times per hour,
Yes.
the
So
ventilation.
many of you will
Real.
remember that about 15 years ago, we started going to this DDC controlled, direct control system, and we have that throughout the district now. Our air quality in our schools is far better than it was 10 or 15 years ago. And it's primarily because of the systems that we have in place. It moves the air, it monitors the air, it knows when to turn it on. If it gets too high of a CO2 level, then it kicks the air on, et cetera. So the overall condition in our schools is much better due to technology and the investment that we've made in our district than it was 15 years ago, for sure.
I just think that people will.
So roles and responsibilities. Staff members will be expected to frequently disinfect high-touch surfaces in their teaching or work areas, including the desks or the tables, in between classes for middle school and high school, door handles, sinks, faucet countertops, coat hooks, as they do already, but just more frequently, and with this new system of the no-wipe disinfectant spray. Our building custodians will be responsible for frequent cleaning of high-traffic surface areas, including bathrooms, entry for all exterior and interior doors, including gymnasiums, cafeterias, countertops, gyms, auditoriums, faculty lounges, supply rooms, and water fountains, if in use. How will we ensure that there is an adequate number of substitutes available for the school year? So Human Resources and their staff contacted all existing substitutes, and they found that a comparable number to other years that are non-COVID years have committed to returning as substitutes. In an effort to recruit and retain qualified substitutes, we will be holding new substitute teacher trainings on a monthly basis throughout the school year. How will we accommodate for physical distancing? This is a primary concern by staff members and community members. Schools, we know, were not designed to accommodate physical distancing. So we are going to have to do the best that we can do to maintain as much distance as possible. Reopening schools will require certain procedures to be in place to ensure the safety of our learners and our staff and return to school campuses. Staff members will be expected to remove all non-essential furniture from their classrooms. We want to be able to have as much space as possible, so anything non-essential will be asked to be removed from those. Also, the American Pediatrics Association suggests in a school setting with face coverings that physical distancing space can be reduced to 3 feet to 6 feet, and really just encouraging to the greatest extent possible to be able to cover that physical distancing. So we need to be weighing the benefits of strict adherence to those guidelines between students with the potential downside if remote learning is the only alternative. And that, again, is taken from the American Pediatrics Association, and there's a link to that guidance that they provided to reopening schools. How will teaching responsibilities be defined? This was a question asked by Mr. Facer earlier. Will instructional staff be expected to teach learners in person as well as teach those learners that enroll in the district's online learning program? We will clearly define the roles for the teacher and their teaching assignments. Those will be made accordingly for in-class instruction or online instruction. During a hybrid model, teachers will be expected to create in-person lessons as well as lessons that can be done in a remote setting. Prep time to accommodate that lesson planning will be included in that hybrid model. Learners opting for the online learning program will receive instruction from their assigned online teacher or program. Communications with deadlines to enroll will be distributed to parents through Infinite Campus and social media. And for more specific information, there's, that information we went over in the roadmap provides more detail. We will be offering professional development is always a focus of this district, but this year it will be focusing on how do we support teaching and learning through COVID-19 with strategies that can be used any time of year, no matter what instructional model is being employed at the time. So these are some of the things we've done during the summer. 3 sessions of G Suite have already been offered. We will continue to offer G Suite sessions throughout the school year. Selected teacher and instructional staff are going to be developing a 1-week remote learning lesson plan that can be taught at any time. So should we need to have that transition between one instructional model to the remote learning model, we will have those lesson plans ready to go, developed by our teachers following our curriculum. August 7th and 18th, distance learning playbook session presented by visible learning expert Doug Fisher will be presented to administrators and instructional staff, and topics will include sound instruction and student engagement, no matter which method of instructional delivery is being used. And November 3rd, a seminar presented by Dr. Sunny Magagna, an award-winning teacher, pioneering educational technology researcher, and best-selling author of Disruptive Classroom Technologies. Topics will include a greater awareness of instructional practices with technology and maximizing student learning. And then the focus on building PD and PLC time will be how to further enhance student learning during this challenging time, independent of which category or instructional model is being used. We already went over the hybrid schedule, so we've given an example of what that may look like. Again, those plans continue to be in development with Ms. Pettit and Ms. Craney working directly with their building administrators and what will work best in these settings. One of the questions was, why are we being asked to implement seating charts? This was a recommendation that came from the health department, and for me, it just clicked as a really brilliant way to be able to identify if we have a symptomatic learner in class or a symptomatic teacher. Using that seating chart will help the health department do their contact tracing, so that it may not be required for an entire class to self-quarantine based on what was happening in that classroom. And they'll be able to identify where the learner was sitting, and they use a circular model to identify those. So it's really a request from the health department to help. And I think just working in that partnership is a great way to move forward. So we've addressed that. Will we require mass testing or other measures? I mentioned this earlier, those screening mechanisms that people read about in the media and think are really important. We've gotten direction from our health department on whether or not we should be requiring thermometers and temperature screenings as students enter the door, or will we be doing a baseline testing? And those things have been discouraged at this time by our health department. It's a resource issue. They need to save those resources for people who are exhibiting symptoms. We've all seen that those testing times and the result time is being extended. It used to be 3 days. Now it's taking 7 to 10 days. Not all people with COVID have a temperature, so it's not always a really good indication. And then logistical issues of what happens when a learner is sick, and then the variance in the reliability of the thermometer. So what the health department does recommend that we do is that we take temperatures once those individuals start feeling ill, or if a teacher observes that a child appears to be ill. And then we will provide touchless thermometers at every school in the main office, as well as our special population programs. What is the protocol if a staff member or learner experiences symptoms of COVID? We already went over that, and returning, just using those 3 indicators for when it's safe to return. What is the protocol for discontinuing self-isolation? Those are those 3 markers again. And then what special accommodations will be made for things like, we had lots of just independent questions about, what do I do about my PE class? What do I do about music? What do I do when I want to take the kids to the media center or library? What happens with hallways, transitions, recess, sharing supplies and art. So we had a conversation yesterday, and we wanted to include some feedback from that conversation with one of our elementary administrators. Those administrators have been meeting weekly to brainstorm, discuss, develop school-specific plans for each building and each grade level. For many of these topics, there's not a one-size-fits-all approach. What works in an elementary school with 200 learners versus what works in a high school with 1,600 learners is going to look different. And so our administrators have been masterful at coming up, sharing ideas, and adopting ideas together for what will work, and doing that in a creative, pragmatic, and efficient way. So if we encourage staff members to contact their building administrator if they have specific concerns like these that don't really fit into that one-size-fits-all approach. So we will continue to update this document as more questions arise, as we confirm details. It's a living document. We will make it readily accessible on our website, as well as email that out to staff later today so that they can begin to get some of the answers that they are seeking at this time.
Yeah, about BLTs.
Yes.
So I met with the elementary principals yesterday, and many of them have started to meet with their building leadership team so that they collectively make these plans that fit their buildings. And they're getting the input, from the teacher's perspective also, and I think that's really important as they move forward, that it is this collaborative approach at the building level. And the BLT retreat will cover a lot of those things. That'll be a lot of what their topics are. How are we going to make this look for our school?
Well, I would just say kudos to all of you. This is a massive, huge undertaking. And I think you've done a wonderful job trying to take input from community and staff and others and work with the Southeast Idaho Health District and all those governmental agencies that you have to deal with and things, and it's an ongoing process, that's for sure. And
Every night it's on the news.
and it can change all the time, but I think you've really tried to look at pretty much everything. I know there will be things that come up, but I am very impressed with all the hard work that you have all done. And my hats are off to you all.
Thank you very much.
Yeah, this sure answered questions that I've been asked
Good.
online, so I think, it's a good deal.
Okay.
Did a good job.
Thank you. So before I turn it over to Ms. Wilkes, we are asking that you take action on the roadmap with the changes that we discussed. The primary change that we are asking to be made is to require staff and learners to wear face coverings. And with that, I will turn it over to Ms. Wilkes to talk about the athletic guidelines.
So this is fluid as well, as you guys all know.
Ms. Wilkes, in light of the time that we're spent on this already, if you could just kind of move through yours rather quickly, that'd be
I would love to.
great, yeah.
Renee, do they have a copy of this?
No, they don't yet. Let me.
So I took Ms. Fisher's quick snapshot guidelines and created an athletic guidelines. And so Renee's going to email these to you. I took Idaho High School Athletic Association requirements. They had 4 of them. The 4 requirements is to create a plan, which is what we have done, and to be approved by you, and working with local health department. And again, we meet with Ms. Mann weekly. We have her cell phone, which is probably not good. Work on transportation plan, a plan to deal with a positive case, which we have already experienced, and a plan to participate afterwards and so forth, which is all in here. I think the key things in here are that we really do want to move forward. It is dependent on the roadmap, and it is dependent on the Idaho IHSAA guidelines. We want to adopt them as well because they are sport specific. They took a coach out of every region, and we met weekly since June 1st, talking about the different requirements that we would like at each sport level, and so they come up with some guidelines that we would like to adopt as well. We've worked with Brent Fari as well at the Portneuf, getting his input on this. I felt like we've got all the key partnerships in place, truly, and I think the biggest thing here is just making sure everybody knows that in order to continue on, in order to be successful, is to follow these guidelines. We had the one episode, and that opened everybody's eyes that we really do need to do this, and we haven't had any episodes since. We had extension from that episode, but we're doing really well. We're putting on camps right now. We're participating in some tournaments right now. They are limited fans based on the facilities. We have all the requirements based, the only extension that we added on was that all coaches are required to wear face masks, so I supplied them with face masks, hand sanitizer, thermometers, and gloves, so all the supplies that they need. So I think we're doing really well to model that it can happen.
What about fans and face masks? Was there any recommendation with fans and face masks?
I have on here that, under guidelines for events, coaches and contestant personnel required. Also, mark spacing or limited spectators, depending on the facility, to allow for appropriate physical distancing. Spectators will be required to wear face masks at all events. I sent this to Ty Jones, IHSA, got his approval on it, and he put required, and I sent this to Miss Mann, and her request was we require spectators to wear face masks.
And I did just include that in the addendum, and I emailed it, so it should be in there.
So they're asking that we require it.
You
I-
know, and I know the face mask issue is gonna be
Yes.
the big deal, but I do have to say, I told Doug this, I saw a simple little blurb on Bill Nye the Science Guy. And I don't know if you saw that, but with this little candle there and putting face masks on, different types and everything, and blowing the candle out without a face mask, and then putting any type of face mask on, and how he could not blow the candle out, you know, and he
Right.
just said about the protection from people and you to them, and I just thought if we really care about people and wanna really help this virus, I think we all have to be in this together.
I agree.
And I would say, I'm gonna really date myself, but when I was very young, I had measles. And it was in Salt Lake City, and the health department came around and slapped a quarantine sign on our house that was there for 2 weeks. And what I know is that there are public health laws that are meant to cover all of us.
Yeah.
Masks should be there.
Yeah.
And I mean, sorry, it isn't against your constitutional right.
Well-
It's against all of us if you decide not to protect us. That's the thing that, I mean, I feel pretty strongly about it.
And then too, I was reading about the pandemic, the Spanish flu, you know, in 1918 and that, and they had 7 months where they had to stay home and do things, you know, they were required, they couldn't do. And I thought, you know, we don't like it, but it's a doable thing,
Yeah.
and the more we work together, the sooner.
Yeah, and it's really important for our athletes to continue and our students to continue, so if that helps them, yeah, absolutely. So I know this got emailed or.
Yeah, and I also forward the board the IHSAA 50-plus page document, so they could read that at their leisure, but they would have a better understanding too of the direction that the
Right.
IHSA is.
And again, they had 4 requirements, but mostly guidelines. I'd like to adopt those guidelines, though. They're really good, and they're connected to the categories of the health department per sport.
Mrs. Fisher, the other changes that we'd asked the board to adopt with this plan to make it final was just a change in the dates, or were there others?
Change in dates, we are going to add the lunch scanner to
Oh.
that.
Okay,
There were a couple other little things that we caught as we went along that need to be moved into the green category from the purple category.
okay.
And then just continuing to further identify protocols that wouldn't necessarily fit in the roadmap, but will be communicated internally to staff
And the online piece where, in elementary schools, if when they
Yes.
sign up for that, it'll need to be a trimester rather than
Then the
6 months.
mid, yeah,
Yeah, just for consistency
right.
is what we were
Right,
looking
and
at.
we'll be adding the lunch cards, requiring face masks, you know, adding clarity to those categories, through communication. That was one of the, moving forward, and linking to that SIF document so that people really understand. Those were the things that I had noted.
Okay, so it doesn't change the context or necessarily even the content in many ways. It might just be moving a date here or there. But the big issue will be the mask for you to consider.
One other question that I have, and, when there's a school closure for snow, we get the alert on our phones. Will that happen for this as well? We've moved from category A to category B today.
Yes, and the health department has expressed to us that they will try to give us a 24-hour notice or more if they can, before that happens, but we all know that, you know, this changes on the hour. So, we will be in constant contact with Ms. Mann and the health department for which category we're in. They will try to give us advance notice, and then, yes, we will use our messaging system to communicate with parents about where we're at or if we need to make a change in any way. So it's really important. We'll send some communication out about making sure that contact information is accurate in Infinite Campus. That is our mechanism for communicating emergency messaging. So we need to make sure that we have the most robust information that we can.
Along those same lines, when we meet with her once a week, the other thing that was reassuring to me is when they have a confirmed case, she said that they absolutely start that contact tracing and that they have made contact with people. They try and do it within 24 hours. She said they've had some issues with people as far as answering their phone because it's an unknown number. But I just felt that that was really important information, that she really says that they get on it. And I think that's the piece that's real critical too, is there's so much that involves a case by case that we have to be so fluid and flexible because of the different amount of people that become in contact and those things. But that one day notice was a real reassurance to me that they start that process right away.
They're working out a fluid system too, that if like a student athlete had it, that they would email, or I'm hoping fax or email us when they're cleared. So that they don't always have to go back to the doctor, they will do that process. So they're working on a little bit more expedited. Right now, it's pretty long and it comes through the mail, and we're working on making that a little bit more expedited.
Right. The one other thing I would say about the mask recommendation and being required is that it's masks and or physical distancing. So the masks really help our ability to not meet that 6 feet at all times guideline. If I said that.
What do you mean and or?
So if you have a mask on that need to have 6 feet of space, it can be reduced
The
with
feet,
the covering, yes.
but you,
Don't
But-
have a mask, you need at least 6 feet.
but
Well,
we're
3 to 6 feet.
requiring masks.
Yeah, they're
Right.
not gonna be a
So
choice.
an and or isn't gonna,
No, there's.
But we're still going to try to the best extent possible to enhance that
Right.
physical
I
distancing.
can
But the
see-
masks is just that one more enhancement to,
right, and I can see if we're requiring masks, but when you say and or, it means so, if you don't have a mask, then you have to be 6 feet.
There is no,
But that's
No,
where I
no,
think your
there's-
wording is a little,
right,
We won't say
They don't
or.
give them the
and
option
or,
to
we
or.
don't give them a,
yeah, that's right.
right.
Can't.
you know.
And just as for all of us, I mean, we need a break from the mask every little while. And so when that distance can be, you know, outdoors perhaps, increased greatly, there may be an opportunity to remove the mask for a time. Yeah, kind of a mask break. So we'll have to build that in, but certainly during instructional times, in the classroom, in the hallways,
Fine.
yeah, that's what we were thinking, but there will have to be some breaks from the mask for sure. Yeah.
Is that it?
Thank you.
Thank you.
Thank you for your time.
We'll now move to curriculum, instruction, and school safety, and Dave Minor.
Be a long meeting.
We'll move it along. The rest should be fairly routine.
Good morning, right. I'm going to take us in a completely different direction, but I will do it quickly, right? And I just want to bring some things to your attention with respect to a situation we've encountered in the world of special education. The Individual with Disabilities Education Act stipulates 20 compliance indicators that LEAs are required to meet on a yearly basis in order for us to continue getting our federal grants and so forth. Most recently, we have come under scrutiny, so to speak, from the state with respect to our over-identification of Native American learners who've been identified as having a specific learning disability. Now, briefly, and this is in your packet, so I won't belabor the point because I know we're running out of time and we need to be succinct. I get that. Idaho defines overrepresentation in a particular eligibility category as something that represents 3 times that of a typical non-Native American learner. So in our school district, we have found ourselves at a point where we have, and I won't even use the word erroneously because I'm not even sure I believe that, but we have, for purposes of accountability, have identified our Native American learners at 3.5 times the rate of a typical non-Native American student as someone who is struggling with a specific learning disability. So of our 20 indicators, indicator 10 is that. It's LEAs who show a disproportionate representation of racial and ethnic group in a specific disability category. The specific disability category is specific learning disability, and we have over-identified at 3 times the rate kids who are receiving services under a specific learning disability eligibility category. So that being said, we've developed a plan. We've met extensively with the State Department of Education. We've got a team here that consists of myself and some Lori Creaney, Gretchen, and we're working dutifully to determine how best we can kind of turn the tide. Now, bear in mind, we're talking about a pretty small number of kids, right? Less than 40 that have been identified as having a learning disability at a greater extent than what the federal people like us to say these kids struggle with.
So they want you to lie?
No,
We've been here
and
before, too.
and we can get into that, right? I mean, we can talk about the how much of it makes sense or not, but generally speaking, we have found that some of our young Native American learners, first time to school Native American learners, are coming to us with difficulties with oral language, academic vocabulary, English language proficiency, and as we provide intervention through our RTI process, which we do very well, by the way, we work diligently at trying to identify what is really at the core of the problem, right? And as these children matriculate and get to a point where we've given them all the interventions we can, we come to a point where do we need to consider a referral for special education? And at that point, a student who struggles in oral language, academic vocabulary, those kinds of things, will often be tested or assessed as having a specific learning disability in the area of English language arts. Almost exclusively, our kids that fall under that are being identified as having an English language arts learning disability. So what we've done is we've, like I said, we've put together a team. We've got a plan. It's in your packet. It tends to, just by demographics alone, it tends to be a Tyhee Elementary issue, which kind of bleeds into the Hawthorne Middle School, and then Highland High School are our 3, if you wanted to categorize where the majority of our Native American learners are. It's in Tyhee, Hawthorne, Highland High School. Our goal is to intervene at that oral language, academic vocabulary, general language development at an earlier age, not that we haven't been doing it, but we need to become a little more focused. And our hypothesis is, after we've talked about this and had input from the State Department and so forth, is we have erroneously identified kids as having a learning disability, when in fact, it's a language development issue. It's an oral language, academic vocabulary, possibly related to some cultural kinds of barriers, but that's where we find ourselves. So we've been tasked then to develop a plan to address that. And that plan will involve some professional development at Tyhee Elementary, the first day of school, or when our staff come back on August 17th. We have a well-known language development expert coming to us who's going to address the Tyhee Elementary group in 2 separate sessions. We've also identified key staff people who are going to be in charge of looking at the referrals, looking at how we identify students with disabilities, particularly our Native American learners, and making sure that we're doing our very best to determine eligibility according to how the child's language development has progressed over the years. So again, bear in mind, we're talking about a pretty small number of kids, right? In the grand scheme of things, I think we have roughly 480 Native American learners in our district. 43 of those learners have been identified as having a learning disability at a higher rate than their non-Native American kids. So what we're going to do is address that in such a way that we hope to target Fort Hall early intervention, Head Start, trying to get some services, some early screening mechanisms built in out there so we can identify these youngsters earlier and provide that level of intervention at more targeted toward their language development and just general vocabulary comfort, so to speak, rather than looking at that as a learning disability, seeing it more in terms of a oral language fluency kind of an issue. So we'll start the year off working at developing protocols and interventions with Tyhee Elementary primarily. Our Lincoln Early Intervention Program has, in conjunction with Head Start, will be working to identify our youngsters out at Fort Hall who are struggling with this and trying to identify these kids a little earlier, trying to get some streamlined interventions in place a little bit earlier. And then as they move into Tyhee and so forth, we'll have a mechanism in place that we can hopefully identify these kids and steer them away from a specific learning disability, unless that is truly the case. But looking a little more intently at that oral language fluency, that academic vocabulary development, and working at ways to develop interventions in that respect. Now, the bummer part of this is because this has happened, we have to set aside X number of dollars. 15% of the federal grant that we get for students with disabilities, kind of in a set-aside manner, if you will, that will allow us to take care of the expenses and the staffing requirements and the professional development needed to rectify this issue. This district has been in this situation a number of times. Unfortunately, it's a conundrum that we find ourselves in. We provide wonderful services. Unfortunately, at the federal and the State Department level, there are metrics that drive their decision-making that kind of trickle down, and one of those is the over-identification of Native American learners as residing within a specific eligibility category. So, not to belabor the point, the plan is in your packet there, and I'd be happy to talk specifically about that, but I know we're kind of in the midst of trying to get a lot of information disseminated in a fairly quick amount of time. So bottom line is we have a plan to address the situation we find ourselves in. And it's not a matter of us not providing services. We do a wonderful job at identifying the needs and providing those services. It's just how we categorize what a particular student's disability profile looks like, from that of a specific learning disability to something maybe a little more in line with a language development problem, if that makes sense. Okay,
Dave.
thank you.
Chuck?
You have policy 8203, graduation requirements, included in your packet. And the policy suggestions really are just cleanup in nature, and we received no public input after first reading. And so you'll be asked to approve the policy under second reading here in just a little bit.
Okay.
Okay, thank you.
Thank you. Lori?
Okay, Head Start. So Ms. Bray has given me some updates here to share with you. The management team has been working on plans to reopen for the 2020-2021 school year. And they're aligned with the district recommendations. They've been looking at recommendations from the CDC, the health department, and guidance from the Office of Head Start, who has come out with many recommendations. So for the part day option, each class will be divided into 2 groups with no more than 10 children present at one time. Children will attend school 2 days a week, Monday, Tuesday, or Thursday, Friday. So it'll be that hybrid model that you've seen in the district's plan. They'll participate in remote learning the other 2 days. Children in the full day option will attend school 4 days a week and receive remote learning for the other day, and class sizes there will be limited to 10 children. The program has experienced a decrease in applications. They anticipate starting this school year under-enrolled, but the Office of Head Start has anticipated that programs will need to implement a variety of program models, and they've provided that flexibility and guidance for those. The program is prepared to adjust schedules during the year per recommendations from the Health Department and Office of Head Start and the district. Financial report, the program submitted the fiscal year 19 budget revision on July 1st. The request was to reallocate funding to go towards the purchase of the new modular units. The request is in process. The notice of awards for the fiscal year 20 Head Start continuation grant and the COVID-19 grant have been received. The continuation grant was awarded in the amount of $2,380,775. The COVID-19 grant is $148,518, and the Head Start Quality Improvement Grant is still in process. So for the facilities, the program is completing the final stages necessary to submit the facilities application. We've had to do lots of legwork on that and bring in other people in order to get their expertise in that area. So they anticipate the old modular will be removed by the end of the month. We had to slow down that because we had to get approval there. Personnel, they're continuing the interview process. They found that their entry-level positions have been the most challenging positions to fill, and several highly qualified applicants for the positions that require degrees. So that's where they are in their staffing. They've been back, last week they came back and started working, the management team did, so they're back in the office is open there and they're back at it. Kindergarten numbers, you'll see there. There's an update, yes, as of yesterday, it's 624, so yeah, we've been watching that every day, and we're hitting it, and we have some things going out, and we'll continue to do that, but we know that lots of people have been looking to what the district is doing, and there are just so many questions. It's just a very, very different year.
That's pretty low, really, from what we've been.
It is. We're watching it, and just trying to anticipate where we're going to be. Our low ones that are down from where they were the year before, the lowest were 26 at Indian Hills, lower, Syringa 23 lower, and Tyhee 22 lower than they were last year at that same time period.
COVID-related.
Idaho is full at 50 students. That's how many we can have there. Gate City has room for about 5 students, and their enrollment is the same at this time last year. With those numbers, we're not in an overload situation yet. And Green Acres is another area where we've noted an increase, and they're up 6 students from last year. So their numbers they can handle, 50 students, but they do have our ERR students, so 50 inclusive of our ERR. So those are where our hot spots are and some of our low spots. So we'll continue to be pushing this. We have kindergarten registration. We'll be sending that out. Registration is going to be on the 4th of August. And the people who have registered already, we'll be having them come into the buildings. We'll be encouraging, you know, others to come that day. And we'll just maintain social distancing, and they'll be meeting with our staff. We're working on it.
Tanya?
Okay. I have a couple of things to share with you guys today. First off is, the out-of-state approval. It's March 11th. It's the ski trip that they went on this year right before we went into safety mode. It's an outdoor program, and this will all depend on what category we're in, obviously. Any questions on that? Okay, the next one would be student discipline data. I think the last 3 months of school helped with my numbers. Make up for the first couple months of school. If you all remember, we got to know each other. It was like initiation for me, I think. But they look pretty good. We had 134 DDRCs in the secondary level. We had quite a few expulsions. We had that one huge incident, and then an overload of knives this year, and not necessarily, you know, in a harmful way, just having a knife at school and so forth. So we're definitely going to work on that. Elementary DDRCs were 7. We're definitely, you know, on the same curve that Mr. Hobbs had created for us with restorative circles and justice and so forth, which I think have made a really impact. We broke it down by incident on the next 2 pages for secondary and elementary. I'm pretty pleased with these, but again, I think the last 3 months helped us a little bit. Any questions on that? I think our path is definitely accurate, and we continue down that path. We're definitely aware of the social emotional learning that we're going to have to face this fall, and we're going to address those as per curriculum with adding to the curriculum and equity in the classroom. So we're addressing both of those.
Yeah, usually we're pretty busy in March, April, and May.
I think, I don't know. I think the beginning of the year, you guys trained me really well, so it was good. All right, and the next thing is a tough one for me to bring to you in front of the board right now. As COVID unfolds its ugly self to us, athletic programs have undergone many challenges. Unfortunately, our high school swim has undergone very many more challenges. I feel like I'm in a boxing match, just dodging swings left and right. At first, it was back in April, I posted coaching positions, and until June, I did not have one inquiry. I did put the word out there really hard, so we had a few parents apply. We interviewed them. We got ready to offer some positions, all brand new coaches, definitely motivated, but brand new to the coaching realm. And then we had starting block issues. Dodged that bullet. We got those figured out. So the starting blocks should be started or have been ordered and getting placed in. And then the swimming pool broke. And it's like I just keep dodging these punches thrown our way. They are fixing the swimming pool up at ISU, but there is a huge crack down the middle of it, so we're not sure if the water is going to seal that again. I did work with, I talked to Stacy Van Kirk at Parks and Rec, and they talked about where we could, maybe use some later times for swimming practices there as well, but we could not hold meets there. It just kind of encompassed itself on the different issues of facilities mainly. And part of that is, as I told before, spectators are going to be limited. Well, in a swimming facility, we can't have it. So parents can't go to the meets. Our practices could only have 4 kids per lane. We only have 2 hours typically for a practice night. So it's about little more than 7 minutes per athlete, or you just don't practice every day. We can only hold dual meets because you can't have so many kids in there. And our district has changed, unfortunately, from Region 4 to Region 5. So our district level competition is Pokey against Century. Preston does not have a swim team. And then our state facility, the Boise Aquatic Center, has not even opened. And so the state level swimming meet has a very high probable chance to be a virtual meet, so just displaying times and so forth. So all of this, you know, and I've been talking to Karen daily, and it's kept us both up at nights because we don't want to do this, but we also see the writing on the wall in the sense that it's a skeleton program, brand new coaches, dealing with COVID, dealing with how many athletes per lane, dealing with time space, dealing with facility being ready to go. We just feel like as an administrative staff that we agree this opportunity is essential and important. However, given the current challenges noted above, recommends the board suspend high school swimming program for 1 year, and we'll continue to monitor and explore the opportunity in future years. Like I said, we got the platform. We want to move forward, but for right now, we just feel like it's best to suspend it for a year.
And I would ask that, I think that in my wording in the board action, it just says to eliminate the swim program, but if you want to just replace that with suspend, I think that's probably a better word to use.
Does anybody have any questions?
Just a shame. What's
Lots.
the problem with coaches, though? If everything was fine this year, we still don't have coaches. Why?
We did get some parents step up, but they're
You know,
brand new to the, you know, coaching. I'm not saying they couldn't on a normal season do an amazing job, but with COVID and all the facility challenges and so forth, I just don't feel like that's fair to a brand new coach. Even though I understand, you know, their desire and so forth as a parent. And when we interviewed, their comment was quite a bit about just being part of something. Well, now that part of something, we're down to very minimal meets, very minimal practice. Not even
Yep.
parents can come and watch. I mean, it's just,
See,
at
that's,
some point it was like,
my other question is, and I know we've talked about this before, but the Region 4 to Region 5 thing. I mean, I just don't know why those involved can't have more input on just being, I mean, the whole thing is so unfair and so.
I truly
not
agree.
right.
I agree.
There's gotta be some kind of recourse here. I just think that.
And we're working on it. I know, you know, Mr. Matson's, you know, listened to me before. We quit doing things the way we used to do them if they're not working very well, in the sense of it's always been that way. And so we need to do something different, and that has been brought up multiple times.
Yeah.
And as we progress,
Some representation or something, I don't know.
mhm.
It just is really bothersome to me that we just have to take what's handed to us when it's not really right or fair.
Right. And we've fought for this for a long time. I mean, we waited till the very final moments. Like I said, we did interviews, we, you know, ordered we fought for this the whole time through. So this was a very tough decision. Okay, I'm still here. So next is prohibition of sexual harassment. So there's a new sexual harassment policy coming down from the federal level. And so you'll see how we've kind of changed the word and verbiage. I'm going to kind of give you a quick update of what 10 things kind of to expect from the new policy. So the new rules will go into effect August 14th. New definition of sexual harassment must be in policy, and right now 17 states are suing DeVos for this as we speak, so I'm not sure where that'll go. But we're going to move forward. Jurisdiction is narrowly construed. So if you're out at an event of some sort that's school sponsored, then that is considered part of our jurisdiction. So it doesn't have to be on school property. Transparency of who the coordinators are, that'll be myself for students, so I'll be attending on a corner, and Miss Minor for staff. All employees are mandatory reporters. Response in timely manner, must investigate and document, and must have grievance procedures. And then the documentation, if it is reported to an admin of a sexual harassment issue, then they take that, and if they feel like it's a formal, then they give it to the investigator. The investigator will investigate, then they give that to a coordinator, which is myself or Ms. Minor, and then we make a determination from there. So other than some definitions, some more procedures on documentation and follow through. We feel strongly about the sexual harassment policy, and we're doing a pretty good job as we are. Any questions on that? And this is for a first reading, correct, Renee? Okay. And then the next one is a camp request. We have a dance team that would like to put on a camp at Century High School. Again,
Starting tomorrow.
starting tomorrow.
Well, I thought we
It-
talked about this.
It got in a little bit late. I absolutely agree. I did give them the COVID year of, I understand, so completely up to you if you want to
Okay, I'll
support
remember
that.
that next year.
Okay.
Terminology. It's wrong.
We'll see.
That's wrong.
And then the last thing I'd like to present to the board is Portneuf contacted Dr. Hal and I in regards to donations and the trainers that they provide. They, for COVID reasons, could not, get the board together and determine and follow through this year. So they want to do double this next year. So they would like to present us with a $35,000 check at the end of July. And they wrote it actually in the document here, and then one at the end of January to help sustain the relationship that we have. We tried to, really reassure them that this was not an expectation. They reassured that they felt like that the school really did support and do a lot of things, and they wanted that relationship to continue as it was. The trainers are due to come back. We've had a few come back. They're due to come back. The trainer's contract, they were finishing up and should have to us by the end of this week.
That's good news.
It's really good news. Any questions on that?
Nope.
Okay,
Thank you.
thank you.
Business operations, Bart Reed.
Well, on a very positive note, you'll see on the state revenue side that the month of June was a very large collection month. So overall, you'll remember we were like $300 and some odd million in the hole at the state level budget, and that June collection, which was primarily corporate and individual income taxes that came in, made up for that. So overall, we ended the year at a $70 million plus surplus in the budget at the state level, or 1.8%. So that's about the best news that we could probably share in relation to where we were at just the prior month before then at the state level, and hopefully that will continue, but we will see.
Will they give us our 1% back?
What's that?
Will they give us our 1% back?
Or our 5%, you mean?
Well, 1% last year, 5 going.
That would be very wishful thinking. I don't think that will happen, but hopefully that won't continue on to the following year. So, there's a lot of things that you can take into consideration, because most earnings end December, and so taxes are paid based upon your earnings up through the calendar year. So this year, earnings with individual may be much different when we get a year from now, so we'll have to see. All right, on the food service program and our meals that we've been serving, of course, we've still been very busy in that respect, and there's quite a bit of documentation, but let me just summarize by saying that on a weekly basis, we are serving on average 13,085 meals per week, and you can times that times 2 because we're doing both a breakfast and a lunch. And I just wanted to share with you also that since March, when we started serving meals early out in our parks, we have now served over 440,000 meals. So that's very significant, and something that we've been very proud of, that we've been able to continue to do that in our community. Our free and reduced lunch percentages are sitting at about 43.4, so that hasn't changed dramatically from what we've talked about in the past. With your permission, I'll just talk about bus stops first, because that'll be an easy one to take care of. As you know, this will require board action to do the bus stops. We have approximately 1,200 bus stops that we pick up from, and then we deliver back to when we're in our normal school session. We actually have 72 bus routes in the morning and the afternoon, and then we have 23 in the midday. So that's pretty substantial when you consider we have 85 buses that are making over 1,200 stops to pick up kids. So kind of getting back to some of the questions that we were talking about there, we do an awful lot with a few number of buses and staff that we have available.
You know, if I could, Bart, one thing I didn't ask was about, you know, we've asked teachers to clean desktops and things.
Yep.
What about bus drivers? Are they required to clean?
So it'll be a very similar process to what you see in the classroom. So what there'll be a spray bottle, which we're concerned about having to wipe everything down. This particular product, you spray it on, they actually recommend that you do not wipe it off. So you spray it, let it dry, it does its thing, kills the germs, and et cetera. We'll do the same thing in the buses. So they'll have a spray bottle, they'll go through and spray it on the bus seats, disinfect the bus, leave it overnight. We should be good to go in the morning. So a very similar process than what you'll see in the classroom. Okay. In regard to summer projects, let me just mention a couple of things. All of our asphalting is complete and seal coating that we have at our schools. Our tile and carpeting are nearing completion, probably within the next a week to 10 days. Most of that will be done. Bleachers have already started to go up. We've already got the cement pad poured, and the bleachers have started going up at Century High School. So that is well underway and should be completed by the end of this month. They've removed the gym floor at Highland High School. They just started putting in the base, and we'll start seeing some progress on that this week and getting that done. We're still working with the vendor to see if they're going to be on time. We might be a week or two delayed on that project just with the timing of materials coming in and everything else that we've been dealing with there. Roofing, we still have 2 schools that need to be roofed. And you know that we didn't get any bids, and we went out and got some subsequent quotes. I'm still waiting for materials, and some of that can still happen while we are in school and on session because they'll be up on the roof and it'll still be a safe environment. So we'll follow up on that. The HVAC systems that were redone completely at Idaho will probably be tested and balanced within the next week or so and be wrapping up there. And the same for Century High School. We did half the school with the heat pump units, and those are all installed. Now they're just testing them and getting everything wrapped up there. And then lastly, just want to report on Pocatello High School. If you've gone by there, you can see a lot of cement trucks going by. They are near completion with the major cement pads and foundation work that needs to go there. The next part that you'll see probably starting next week is they'll start framing up the outside walls, the perimeter of the building all the way around. And then steel is coming for August, and so you should see the building starting to go up first week or 2 of August here. So that's coming along really well. Okay, thank you.
Thank you. Employee Services, Carl Smart.
I should mention that some of the comments that show up on our Facebook page talk about talking into the microphone. So I'm just passing it along to you as well. They cannot hear you sometimes. So, especially with this nonsense going on as well.
Yeah.
So, because I have been watching in my office. Just have 2 items on my agenda, part of the agenda today. How long do I have? Like 45 minutes, Doug?
What? You may get the gavel if you try that. I don't know.
I will.
Not on the
Very brief. Okay? Of course, we always talk about Infinite Campus, IC, and that sort of thing as a part of our discussion today. IC is done for the regular school year. Summer school, of course, ended here last week. And so we will have one more IC submission for the current year, and it happens to be for the summer school. So we will start preparing that over the next couple of weeks. Our folks in technology have switched over to a new wide area network carrier. Used to be Cable One, and we went to a new carrier, and it was part of the E-rate bid. And so things went fairly smoothly. There was a couple of schools that had little hiccups at them at the beginning, but everything's been resolved. And so I don't know if as you went around during the summer, you saw some drilling going on in each of our schools. That was our new carrier, putting in a new access port to each school. So that was what was going on there. And our folks are preparing right now for the distribution of laptops at the beginning of the school year for our one-to-one device initiative. They've been preparing for getting new laptops in and refurbishing all those that came in that we distributed in March, or I guess it was in April. And so we are getting those ready to go. And so that's basically what's going on with our technology and IC. And in your packet you saw, or you have a copy of the wellness dashboard for the month of June. And our medical went up to 125%, which is not really a big surprise because people could not get in and do visits or a lot of things in the month of March and April, and May. And so that's, like I said, it's not a real surprise. We do have one large claim on there, and so that was probably one of the biggest reasons for the jump in our experience for the month of June.
That was high. That's one of the highest I remember seeing.
I can't share with you what that large claim is, but I know it's there, and it's probably going to be large enough that it'll go into the reinsurance, and so that's probably the good news on that one. But for the time being, it does go against our experience, so it is 125%. But you see the other data in there, and as I mentioned before, it's not a big surprise that we had that big of a jump, and we anticipated once everybody was able to get back to going to the doctor. And so, unless you have questions or comments, that concludes my section of the agenda today.
No, thank you. Okay, Human Resources, Brenda Miner.
Okay, I also get to start with some good news. I'm happy to report that the hiring is very well for the upcoming school year. We hired our last opening in elementary yesterday, and the really neat part about that is the principal was having a struggle trying to decide between two people because there are so many candidates out there that are still really good applicants for our jobs. So the only opening we have is we have one opening in special education at Century High School and one social worker position to fill for our certified staff. So that's great news as we get ready to start the school year. We also have some classified openings that Lori spoke to a little bit regarding Head Start. We have 4 food service positions and 3 in maintenance. We have been advertising, you've probably seen the signs for bus drivers, and a lot of administrators now are getting ready to open their paraprofessional positions. A lot of times they won't open those until August, just because sometimes if we hire someone in late May, we end up hiring again maybe in August because something comes up in the middle where someone needs to take a job before August. So those paraprofessional positions are opening up as well. When we spoke about substitutes, and if we had ample substitutes, because that question has come up, of the 130 that we had available last year, 100 have responded that they will be coming back for the upcoming school year, and that's pretty comparable. When I spoke with Ms. Pettit about that's a pretty comparable number, so that's good news as well. Any questions on staffing you can think of? Okay. The next one is the first reading for policy 7202 regarding teacher supervision and evaluation of certificated and professional staff. If you look at this for first reading, the main component, you can see there's some language touch-ups, but the big piece is that if you notice that moved down, that instead of just having unsatisfactory, basic, or proficient, that we've now added that distinguished category. And that comes along on the heels of House Bill 523 that speaks to an advanced professional rung, which includes a component for distinguished, where the candidate has to have a distinguished in either domain 2, which is classroom environment, or domain 3, which is instruction. So this policy would include the distinguished category. Also, if you notice, there's a draft model for the procedure, which just outlines, there hadn't been a procedure for this policy before, and so this just outlines the deadlines and the dates. Okay? And then the last component for me talks about leadership premiums. And in your packet, you'll see that there's the leadership premiums. We're happy to report that those are back this year for our staff, and how important that was in our negotiations this year. And if you look, it is pretty similar to last year. There's a few less unit development personnel, but just because we didn't use the 114 completely that we had last year, and so those have been reassigned, if you look closely, to the elementary STEM coaches, and so that we just had shifted those payments down to the elementary STEM coaches. The only other leadership premium that is a main difference in there, you may see a lead nurse, and we have one full-time nurse here for our school district, and she has really taken on a lot of leadership roles during this COVID-19 pandemic, making sure that all of our learners that need her assistance have been able to get what they need. Any questions on any of those?
I did notice that there were 2 instances on test coordinators that were $100 less than all the other test coordinators. One was elementary and one was New Horizon. On the amount they get, test coordinators at New Horizon get $900, and at elementary get $900, where the rest got $1,000 or more.
It's based on the number of kids they have and the number of tests they have to give.
Okay, that's all I wanted. Why did, what made the difference?
And then.
Because there is I'm sorry.
No, and the minimum that we can pay. So it's not like it's a prorated amount.
Okay.
There's just a minimum that we have to pay, which would be 900, and then the 1,000 is more
Yeah,
in line with the other positions that we
yeah,
pay.
I just wondered the difference there.
Right.
That-
And if you look closely, the high schools even have a little bit of discrepancy between Pocatello, Century, and Highland, based on the numbers.
Okay, thank you.
Okay? Thank you.
Thank you, Brenda. Superintendent.
Okay, I've got a couple items for you today, Board, and the first up is our calendar, which, as we made mention earlier, the March, April, May months were a little lean, as are the summer months here.
And next week's out, right?
Pardon me?
Next week?
Yes, we had that hearing scheduled for you on the 28th. That will no longer be held. So that just leaves potentially a local issues committee if you meet again with the chamber. And then showing here, all teachers returning on Monday, the 17th. That could be remotely, in person, combination. We'll see how it goes. The 18th is our next regular board meeting. And then we have some student reinstatement hearings. It's showing superintendent's office. It's likely will be in this room just to have our space. And then you can see first day of school, Labor Day, and then we're well into September by that point in time. A board work session planned for September 8th, and we have a couple ideas that we'll be sharing with you as we move forward in the coming months.
Okay, thank you.
All right, next up, 2 proposals that we're recommending to present to the Idaho School Boards Association. And first up, you can see there's administrative leave with pay. And occasionally, we will put a staff member on administrative leave, and they opt to extend their dates for their hearings. And in the meanwhile, the district is covering their expenses, because unless they have a felony charge or charge related to children where they cannot be in the presence of children, those monies are set aside in escrow. Well, we would like to at least have some discussion about what that would mean for other leaves of administrative nature, and if we could do something similar. And so you'll notice that in addition to our district, West Ada is also on board with that. As I talked to Mrs. Amy White at our law firm that we utilize a great deal for these type of things. She mentioned that these other two districts or charter schools would be interested in coming on board with us on this particular resolution. I don't know if you have any questions about that one, or if I should just move in.
Changed a little bit though, didn't it?
Yes,
It's still important, but
yes, and in fact, she's waiting on an answer from me so that we can get that submitted by the end of the month. So if you take action on these two, I'll let her know that we're moving forward. Next up is the personnel funding, and you may recall a few years back, when they instituted this, I don't know, it seems just punitive to me, law to take away use it or lose it flexibility. And when you really dig down deep, take that deep dive into the numbers, you'll see that the difference between an average class size and at the highest end is typically like 1.25 students. 1.25 more per teacher, perhaps. And, you know, it just, so years back, we asked at the time, Representative Nye to carry some legislation forward, which would at least cluster schools of similar size so that we wouldn't be, you know, perhaps, penalized, thank you. I was thinking the word punish. Yes, penalized for those districts that are quite a bit smaller that may have, you know, multiple staff members. So we were able to get that changed in the law, but all in all, we just need to take another look at this because we continue to be penalized year after year. And again, anytime you're looking at an average, there's going to be some above and some below. So that would suggest someone's going to come out a little bit short on the short end of the stick. Even with the flexibility of perhaps 1%, that's still not enough. So we would like to reopen this discussion again, and I would like the board to consider moving this resolution forward.
well, it does penalize larger districts for the most part.
It does, and those that have the ongoing levies that are able to supplant some monies with personnel, Coeur d'Alene, Blaine County, Lewiston, and Boise School District all have those ongoing levies. And so ours, we have to renew every 2 years, and that makes it a little more difficult. And so when those schools and districts are figured into this formula, again, it tends to skew it just a little bit. So I'd like to have that discussion reopened.
Okay.
And I think that's it for me, Mr. Chairman.
Okay. Let's see, now it's time for written comments pertinent to agenda items. And Mary Ann, receive yours, wherever you'd like to speak. Tell me about it.
I just want to thank you for allowing me to speak today on behalf of the Pocatello Education Association. I really don't have a lot to say now because all the things I was going to come up and make recommendations for have already been included in the plan. I do want to say that on behalf of the Pocatello Education, the PEA and the teachers, being able to be included on the planning committee with the cabinet was extremely enlightening in a variety of ways. And we just really appreciated that. When I became president, my goal was to form a collaborative approach with the district, and I believe that collaboration was shown during that meeting. I was allowed to be an active participant, not just kind of stuck in the corner, and I was able to share that with all of the staff, the teachers, the ESP, the paras, and so forth, so that they felt like they do have a voice. You should have received an email from me last night, and I apologize for how it got there kind of late, but in the past month or so, the PEA has done 2 surveys. The first survey was just teachers, and that was not just members, it was all teachers. We had 405 respondents. I've included the comments for you and the data from that. When the district released the plan and allowed for staff comment, I understand that the fear was that non-staff members would comment on it, but The perception by having to log in and use your email account was that my name is going to be associated with these comments, and anyone can come back and look to see what I said, and that worried a lot of people. That I don't think is reality, but that is the perception. And so I had several members call and ask me if I would send out another survey. This time I sent it out to all the teachers and all of the classified workers that work in a school building, with the exception of the cafeteria workers, simply because there's no pre-made email group for them. And so I had to hand type in or type in by name over 400 people. And to add the cafeteria staff to that, I would have been there till 2 in the morning. So from that survey, we received 350 responses, and I've sent that to you also. And I will tell you that many people did not fill out the district survey because of A, being required to use their emails, but B, the perception is that their input didn't matter. That in years past, they feel like we've provided input and it's never mattered. And I believe that with the changes that have been made from the plan that was released, including the requiring of students wearing masks, including providing hand sanitizer, gloves in the classrooms, I believe that is going to show the staff that you have indeed listened to the feedback. And I would never, ever want to repeat this school year with the pandemic that we've had. But I have to say, I believe that this crisis has shown a new direction in which the district, the association, and the staff have pulled together and are working in a collaborative and no longer combative manner. And I think that is going to only be beneficial in the long run. And so I appreciate that. I expressed my appreciation to the cabinet for allowing me to be an active participant in this development of this plan, and I want to extend that appreciation as well. I look forward to continuing this collaboration and this work. I obviously am not going anywhere this summer, and so I'm always available for questions and comments and feedback and participation. So I just want to thank you for that. Thanks.
Thank you. Okay, going to the action items. You're gonna have to help me with this, Renee. Well, just, you know, to adopt this roadmap, but we need to add. So how do you say that?
But adopt the roadmap as amended.
As amended, okay. Well, I'm looking for a motion.
I hereby move that the board adopt the PCSD 25 roadmap for the 2020-21 school year as amended.
And I'll second that.
Perfect. Any discussion? Okay, all those in favor, say aye.
Aye.
Aye. Hearing none opposed, that motion is passed. The second item of business is to hear on first reading the following policies. 7405/8305, that's prohibition of sexual harassment. And policy 7202, teacher supervision and evaluation of certificated and professional staff. Is there a motion?
I hereby move that the board hear on first reading policy 7405-8305 and policy 7202.
I'll second the motion.
Second. Any discussion? All those in favor?
Aye.
Aye.
Hearing all in agreement, motion is passed. The next item is to hear on second reading the adoption of policy 8203, graduation requirements.
I hereby move the board hear on second reading and for adoption of the below listed policy as amended.
I'll second that.
Second. Any discussion? All those in favor, say aye.
Aye.
Aye. That motion is passed. Next item is to approve the out-of-state overnight travel request. Is there a motion?
I'll second.
Okay. All those in favor?
Aye.
Aye. Hearing none opposed, that motion is passed, and next item is to approve the proposal to eliminate the swimming program.
Suspend?
That's sad.
Suspend.
Or suspend, sorry, suspend, which is sad, for the 2020-21 school year.
I move we suspend the swimming program for the 2020-21 school year,
I'll second.
unfortunately.
Yep. All those in favor?
Aye.
Aye.
Aye. Motion is passed. The next item is to approve the camp request, which was late, or close. Is there a motion?
I'll move that we approve that one camp request
I'm gonna suffer for that.
reluctantly. How's that?
Okay, all those in favor?
Aye.
Aye.
Hearing none opposed, that motion is passed. Next item is to approve the Portneuf Medical Center donation agreement. Thank you. Is there a motion?
I move we approve the Portneuf Medical Center donation agreement.
I'll second.
Okay, no discussion. All those in favor?
Aye.
Aye.
That motion is passed. The next item is to adopt the leadership premium plan for the 2020.
Back up one.
Bus
Did I jump one?
Yep.
Oh, the bus routes, next one. Okay, is to set the bus routes for 2020-2021 school year and authorize the administration to make adjustments throughout the school year. Is there a motion?
I move that the board set the bus routes for the 2021 school year and authorize administration to make adjustments throughout the school year as necessary.
I'll second.
Okay. All those in favor?
Aye.
Aye.
Aye. The motion is passed. Next item is to adopt the leadership premium plan for the 2020-21 school year. Is there a motion?
I'll move we adopt the leadership premium plan for 2020-21 school year.
I'll second.
Second. Any discussion? All those in favor?
Aye.
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 Hearing none opposed, that motion is passed. And the last item is to adopt the proposed ISBA 2021 resolutions and direct submission to the ISBA. Is there a motion?
I hereby move that the board adopt the proposed ISBA 2021 resolutions and direct submission to ISBA for consideration at the 2020 ISBA convention.
I'll second. Second.
Okay, all those in favor?
Aye.
Aye.
That motion is passed. That concludes this meeting, and I would entertain a motion to adjourn.
I move we adjourn.
I'll second it.
All those in favor?
Aye.
That motion is passed, and we are adjourned.